First movement that I will have my patient performing is an inclined push-up. I chose this due to the reduced range that the patient has to go through due to the incline. They don't have so much for their chest to hit the bench, as well as the reduced resistance because of the way gravity will be pushing down on them. This is good for patients who may be experiencing any shoulder injuries, as well as any muscle weakness in the pectoralis, in the deltoids, as well as the lower traps. I would not perform this on patients who are earlier than the mid-healing phase due to this exercise putting you through a concentric and an eccentric contraction.
Okay, so the exercise we're going to be doing today is a push-up. So to start off, we're just going to start you with a little bit of a regression first. So we're going to be doing an inclined bench push-up. So I'm going to get you to rest your hands onto the bench, kind of shoulder width apart. And then we're going to get you to step back until you have a nice straight spine. During the, okay, so you're just going to come up just a little bit. Yeah, there. And I want to see you engaging your core, okay? And now you're going to bend your elbows and bring your chest to the bench. And you're going to come back up. Perfect. Okay, go down again. And if you need a little bit more stabilization, you can even bring your feet out a little bit. So widen your stance a bit. Yeah, to give yourself a little bit more. Okay, yeah, perfect. Good.
The next exercise I'll be having my patient perform is a knee push-up. I chose this movement because it's the direct progression from the inclined push-up. This push-up is good because it increases the stability of the patient, as well as reduces the resistance because they don't have as much body weight to be pushing up and down. I would use this exercise in my rehab program with the same injuries that I previously said, so any shoulder injuries, any weaknesses in the pectoralis major, the deltoids, or the lower traps, as well as it can also help working with shoulder protraction and retraction. I wouldn't put this in my program until at least mid-healing due to the concentric and eccentric contraction the patient will be going through.
Okay, so the next push-up we're going to be doing is a knee push-up. So we're going to get you down to the floor in kind of a tabletop position. Yep. And you're going to start to crawl your hands over until your back is kind of in that flat position. Perfect. And I'm going to get you to bring your toes up so that you're not reliant on the toes. Okay, we're going to still, am I still in the video? Okay. We're going to still remember to keep that neutral spine and to engage that core. And then when we're going down, we want to be thinking about squeezing in the shoulder blades, okay? So the same thing, you're going to bend your elbows and you're going to bring your chest to the ground. Perfect, that good squeeze, and then pushing back up. Perfect. We're seeing no rounding in the shoulder blades as he's coming back up, which means that he's having a good scapular plane. Perfect, okay, you can go. The next one is going to be just a full normal push-up. So we're going to get you down to the ground again and get you into a high plank position. Okay, so his hands are a little bit bigger than shoulder width apart. His feet are in a good place. Right now we have a nice neutral spine. He is engaging his core. We're going to do the exact same thing as the last one by bending your elbows, bringing your chest to the floor. We see the scapula is coming in, and he is not rounding his back as he's coming up, and the butt is also not elevating. We have a nice neutral spine. Perfect.
The next exercise my patient will be performing is a weighted push-up. I chose this movement because it's the next direct progression from the baseline movement. This increases the resistance that the patient will be going through due to more load they will have to push up from when they're performing their eccentric contraction, and they'll have to have more stability during their concentric contraction to have that that slow decline. I wouldn't implement this until late healing / return to play. This would be a good exercise for athletes who experience or who need to do a push movement, such as a football linebacker.
Okay, so we're having him start in a high plank position. And for this progression, we are just going to be adding a weight in order to add the resistance of him going down. So we're just going to be adding it over here. Are you in a stable position?
Yeah.
Okay, perfect. Having the weight here. I'm going to be staying near the thing in case he does fail. I can take the weight off. Okay, so you're going to be dropping down, bending the elbows, bringing the chest up. Okay, perfect. Perfect. Okay, you're good.
Last exercise that my patient will be performing is a feet elevated push-up. I chose this because I believe it is the next progression to the weighted push-up. Of course, you can add more weight and that will make it harder, but I wanted to change the angle my patient will be at, which will target different muscles. This one is harder because it increases the range the patient will be going through. It also puts a different resistance of gravity on them, and it does sometimes feel like it's more shoulder heavy. Lastly, I wouldn't do this until late healing / return to play. Yeah, that's it.
Okay, so the next progression we're going to be doing is we're actually going to have your feet elevated, so you have more of an incline as you're going. So I'm just going to get you to go in kind of a tabletop position. You're going to carefully put your feet on top of the bench. Yeah. Perfect. Okay. Yeah, right now we can see that he has a neutral spine. His neck is aligned looking straight down. His scapulas are in a good position. He has a nice tight spine and he's engaging his core. We're gonna now get him to bend his elbows, bring his chest in, and then come back up. So what we don't wanna see is he's not doing it, but what we don't wanna see is we don't want that extra arch in the back to bring yourself down. We wanna make sure that he's staying straight. Okay, you're good, Dad. Thanks.